It's like the meme where they're like,
Yeah.
you know what I'm talking about?
Yeah.
The meme, the TikTok.
Hi, everyone. Welcome back to episode 5 of Divas Who Listen. I'm Bella,
And I'm Miranda.
and we are here to serve up some more tea. We have a couple of stories to read for y'all, and then we will talk about it and
Debrief.
debrief. Yes. With our, I don't know if you have a drink, Miranda, but I have my coffee. I have my pug mug.
I have water. Cheers, Mom.
Oh, cheers.
Period.
In today's episode, we will be sharing 2 stories with themes of doctors not understanding the specific type of vascular EDS compared to other subtypes of EDS, and a situation with a school nurse, which is something that we haven't talked about on the show before. And then part of our debriefing always includes experiences that Miranda and I go through as well, because we not only listen, but we are also people that need to be listened to, and this is why
we're here.
Yeah. So the first one that I'm going to read, this person's talking about how they had a very weird appointment with a doctor, and they're wondering if maybe the doctor was having an off day, hadn't really prepared for their visit, or if like the patient was being a little too sensitive about the way that this doctor was acting.
Mm-hmm.
So they go on to say, my son has a stable, very small aneurysm in his brain that the neurologist wanted to have him follow up and be aware of, like the doctor that they saw. So the doctor started the appointment by saying that the son has EDS, not VEDS, and that there is no research confirming a connection between EDS and increased cerebral aneurysms and vascular tissues. At which point, the parent interrupted to say that there is an absolute proven connection with vascular EDS.
Mm-hmm.
To which the doctor says not to interrupt them, and they were getting to that. Which doesn't make sense, because you're over here saying that there is no connection, but please don't interrupt me because I'm getting there.
Lord.
Then the doctor admits that yes, with VEDS, there is a connection. Speaking of a connection, there's a connection. So then the parent's like, why start out with the lack of connection? Next, the doctor starts to talk about how the best way to diagnose aneurysms is through an angiogram, which again, the parent interrupted and said, yes, but that is contraindicated in VEDS due to huge risk. And again, the doctor says not to interrupt them, and they were getting to that. And let me just say, an angiogram is when they go in through an artery in like your arm or your groin to like basically scope the artery.
Mm-hmm.
And the reason why it's contraindicated in VEDS is because it could literally cause a dissection or cause the artery to tear, or dissection is a tear, but to perforate.
It's a big deal.
It's a big deal. Like, you could also find aneurysms on imaging,
mm-hmm.
and the first thing you want to do is go in with the angiogram.
That's scary.
And like, I wouldn't want a doctor who doesn't seem like they don't understand VEDS to be doing something like an angiogram on me.
Or willing to listen.
Yes.
He's not a diva who listen.
So all in all, it was just a very weird experience, and the parent is thinking of asking the doctor who referred them for a different doctor, or asking a specialist to do some education with them.
Mm-hmm. Oh.
The parent was like, they're not in the mood to deal with the doctor who seems to be discounting vascular events, when in the last month, their 19-year-old child had a vertebral artery dissection, which is an artery in the neck. The spouse had a coronary artery dissection last summer, which is an artery in the heart.
Oy.
And, you know, with that history, they're meeting to discuss the young adult's son brain aneurysm.
That's a lot.
It is a lot, especially because an aneurysm is a scary diagnosis.
Mm-hmm.
And then you're going to this doctor to get some clarification on the diagnosis, see what the prognosis is like, and instead they're mansplaining VEDS to you.
Yeah, they're just shutting you down.
And like, he already very clearly has an aneurysm.
Mm-hmm.
So how can you say that there's no connection?
Right.
Regardless of what the condition is, there's an aneurysm.
I can understand, like, people getting frustrated with, like, being I don't want to say interrupted because like you're just trying to share something, especially when it comes to your health. So I can understand where like doctors already like they have their guard up with
Yeah.
people that just want to give their 2 cents, like WebMD, you know?
Yes, Dr. Google.
Yes, exactly. Exactly. But it should be like a back and forth, I think.
Yeah, it should be a discussion.
Exactly. Yeah.
It's not a lecture.
No, you're not trying to correct anybody either. You're just trying to say, like, this is what I've lived with. I've done my research, and it just didn't sound like the doctor did theirs.
Right.
How do doctors prepare before they see a patient? Like, do they read, like, I don't know what it's called, like their charts or?
Yeah, it would be charts. I mean, you would hope so that they would read the chart before going in, but that actually, I don't know if I ever talked about my neurologist appointment. It was with a new doctor, and I was just establishing care with the neurologist just in case I had something like a brain aneurysm pop up down the line. I wanted to meet with a doctor who knows my history. And when I got into the appointment, the resident that came in to see me, which remember residents are doctors, but they're still under an attending supervision. So the resident was awesome, like super understood why I was there. I told the resident that I had been diagnosed with hemiplegic migraines.
Oh, I didn't know that.
He was super great. When I told him that I had these migraines, and it was only like I would only get them maybe like 3 times a year, once a year, nothing crazy. Like I don't need to be treated for it.
Right.
And what it means is like I would get a migraine, but it would affect my body and mimic symptoms of a stroke. Like only one half of my body would be affected.
What the heck?
Yeah. It's taken me to the ER a few times. It hasn't happened in a while.
Yeah.
But this was actually back when I was living in my hometown. So anyways, I told him that I was establishing care, whatever. So then the neurologist comes in and she's like, and first of all, I took my whole, because it was in a new city, like I took my whole history that my primary care had documented since I was 5. I was 25 when I established care with this neurologist. And I made sure I uploaded it to the chart. And I had it with me, a copy of it. And she comes in and she's like, because I also have von Willebrand's disease. So she's like,
Yes.
how did you get diagnosed with von Willebrand's disease? And I was like, well, I had the von Willebrand labs done and I've been like followed all my life. Like they've been fluctuating between below normal and low normal. So I've had this diagnosis. And she's like flipping through the papers and she's like, I don't know, like what were your labs like? And literally the first line on the first page has my labs that in 1999 was my diagnosis. And then so finally she gets through. After I'm trying to explain to her everything, she's like, oh yeah, okay, I see it's right here. Like, yeah. And they had this before the appointment. And then she starts talking about VEDS and she's like, how'd you get diagnosed with VEDS? And I said that I had genetic testing, like I had a skin biopsy done. And she's just going through the paperwork again. She's like, because we don't want to be treating you for something that you don't have. Like, we need to make sure. And while I appreciate that she's making sure I had a correct diagnosis, that was not the way to go about it.
Right. You don't say that to a patient.
No. And it's literally all in the paperwork that if you just looked at my chart, you would have seen everything there. If you would have listened to the resident explain my history, you would have known that. And it wasn't until I told her that I worked at that university where she practices that her demeanor changed.
Really?
Yeah.
Dang. You know what this reminded me of? Like when I'm giving my students directions and I've left it all on my board. And I'm like, okay, what you do now, what you do next. And it's all right there in front of their face. And I've laid it out so it'd be easy for them to read on their own, but they just don't. That's really frustrating.
Yeah. So, and to answer that question, like being in the healthcare side of it, I have seen doctors rely on people who see patients with them to give them the entire history. And I have also seen doctors that extensively go through a patient's chart, look at the images themselves and the pictures,
Right.
and really do a thorough check. So I think I just have to say it's dependent on who the doctor is or maybe how much time they have that day, because I think a lot of the time too they don't know who's on their schedule until they're walking in the morning of the clinic, and I doubt there's even time for them to really
No.
go through a person's chart.
I can't imagine there'd be.
Yeah. Which brings us to the point of like why you have to advocate for yourself, and then why doctors need to listen to you advocating for yourself.
Mm-hmm.
Right?
They do. That's going to go into what I want to share later. Like doctors paying attention, though.
Yeah. It's amazing.
Mm-hmm.
And I don't know if I said this before either, but my physical therapist, who was like one of my besties, he always said that unfortunately doctors like that who listen and, you know, are compassionate, like they are the exception when they should be the standard. And that sucks.
Yeah.
That was story 1, and we'll have Miranda read the next story that we got.
Okay, we have another story that I'm going to read. It says, on Monday, March 24th, a 13-year-old mentioned to their guardian that they had some pain in their armpit. It didn't seem serious, so they were sent to school. The next morning, they were feeling weird, and weird is in, what are these called?
Quotes?
Quotation marks. I'm on summer break, y'all. Leave me alone. That they were feeling weird. The guardian sent them to school again, but then told them to go to the nurse if they were feeling ill still. They did visit the nurse and reported feeling weird or off. The nurse didn't triage. Is that how you say that?
Mm-hmm.
Didn't triage them, and since they didn't appear visibly ill, told them to return back to class. While walking back, the student called their guardian and said they didn't feel well and noticed that their right arm looked more pale than the other. Oh, this is getting scary. The guardian told them to return to the nurse's office and also call the school's front desk, asking the nurse to at least take their blood pressure. When the student returned, the nurse tried to take their blood pressure but couldn't get a reading or detect a pulse.
Ooh.
She noticed the arm was white and then checked the other arm where the blood pressure was found to be very high. And you told me that high blood pressure can like indicate that your body is sick or it's like in pain or something, right?
Pain can cause that blood pressure to go up.
Mm-hmm. Okay. I mean, obviously something's super wrong here.
Yeah, especially it sounds like that they couldn't get a reading on one arm and one other arm it was high.
Yeah. That's so scary to me. Okay, last part. The nurse called the guardian, said the student needed to be taken to the hospital. The guardian requested that an ambulance be called, but the student became upset and tearful, not wanting to go into the ambulance. It was later discovered that they had an axillary dissection and a large blood clot. Did I say that correctly? Axillary?
Yeah. So that is the axillary artery is like armpit area.
Oh my God. Is that something that people would know?
No.
A 13-year-old.
Especially in a 13-year-old, yeah.
Yeah, I'm like double that. Wait, more.
More. It's enough slices.
I'm way older than that. And I don't even know. Like, that's crazy.
Yeah. And I think in general, people don't know what a dissection even is.
Mm-hmm.
And if you have somebody, which we can't really blame the school nurse. They do not teach VEDS in nursing school. But who knows whether or not she had the protocol to triage appropriately.
Mm-hmm.
Like, if there are kids with certain medical conditions, the nurses should have files for them.
Yeah. Or like red flag if they come in.
Yeah. And to me, drilled into my head in nursing school was assess.
Mm-hmm.
So how are you going to have somebody come in? And yeah, a lot of kids want to get out of class and they're minor things. I mean, I did a clinical rotation at a high school and it was mostly like, drink this water, sit for 5 minutes, go back to class.
Here's a cooling pack.
Yeah, but you can't discount the kids still.
Yeah.
It would be worse if she knowingly sent him back to class with the knowledge of VEDS and like if he came into the office and gave the nurse the name and she looked at him up and you see it's a serious condition, like you should do a little bit check. I mean, at the very least, blood pressure.
Yeah, that seems like something quick that can be done
very easily. Check for the pulse.
I know the first time that the student went to the nurse, the arm appeared to still look normal, but it just felt weird. But then on the second go, it was pale and feeling weak, I think they said.
Yeah.
That's
And it took him knowing his own body
Yep.
to point that out at such a young age, which is scary.
Do you think that that's common with kids that get diagnosed young? Like, do you feel like they know more than other kids? Like, okay, well, if somebody's not listening to me, I just need to keep going and call my mom or something. Like, is that how you were?
I don't know. I can't remember how I was in middle school because I was diagnosed when I was 10.
Mm-hmm.
I just think we had a really good system in place where I think anytime I went to the nurse's office, they would call my mom.
Right.
Like they would just
The nurse
let my
knew.
mom triage essentially
Mm-hmm.
if everything was okay. Like I would fall and get open cuts and stuff, or there is even protocol in place for me, like if I wasn't feeling well, to just go lay down in the nurse's office.
Mm-hmm.
But I think as a teenager, you don't want to be perceived as different. And so if you truly are like going to the nurse's office as somebody
Right.
with VEDS, I feel like it's something that should be looked at pretty
Mm-hmm.
closely. Because also I think we naturally tend to save like our big ones for emergencies, you know?
Yeah, that's really scary.
It is scary.
A 13-year-old with the blood clot at school.
Yeah. Like, and it's all about timing. What if he lost his limb because of
Ugh.
people not paying attention?
Mm-hmm.
What if he never called his guardian?
I'm glad that they did that.
Yeah, that was really good on him.
Mm-hmm. True.
Look at him advocating for himself at such a young age.
We love to see it. The youth is okay.
The youth is like, there's hope for humanity. This story really makes me happy that to know that somebody so young is listening to their body and already learning how to advocate for themselves and realizing that people need to listen.
Yeah.
I don't think it's talked about the mental toll that it takes on us when we have to spend our energies like making sure doctors listen to us and
Right.
advocating for ourselves. And it happened to me recently where I was diagnosed with a carotid artery dissection, which is the artery that feeds the brain in the neck area. My dissection is like where the neck meets the skull, or it's kind of like in the skull area, the artery. But it was a whole roller coaster because I went to the ER with neck pain and chest pain.
Yes.
And that in itself, like, they didn't almost want to do a CT scan for me. And they were concerned about radiation. And I'm like, you know what? I've had so many of these. I'm not concerned about radiation anymore. Like, whether it's cancer or VEDS, something's going to take me. Just do it.
Don't say that.
You know?
Yeah.
So the resident was like, okay, we'll go ahead and do chest only. So I was like, all right. And that was a time where I wasn't going to advocate for myself because I thought it was just anxiety. And then he came back in and he was like, we'll go ahead, we'll just do neck too. And I'm like, okay.
Oh,
and
wow.
that's how they found the dissection. And so I'm sitting in the ER having to process that I have a new dissection. Who knows what that means? Like, am I going to have surgery eventually? Could it rupture eventually? Is it going to impact my life? Right? So I'm processing all this. I call my mom. I'm crying. Like, you got to come. You got to come to my city and help me.
No, you gotta come to my city.
Come through, please, Mom. So then my 2 VEDS specialists looked at the scan and said they did not see a dissection. So then I had to unprocess having a dissection. I was living for like 2 to 3 weeks thinking, oh, I don't have a dissection. I still have weird pain here,
Right.
but at least it's not a dissection. And then I got a follow-up scan of just the head, which again reported the dissection. I saw my specialist and they were like, I still don't think it's a dissection. So I'm like, what is it
wow.
if it's causing pain? And they were like, well, maybe it could be an artery that's becoming tortuous, meaning like it twists. I'm like, but would that cause pain? And they're like, no. And so then I'm like, what? Like, nothing has ever showed up in the artery in my scans before. I've had scans since I was like preteen, I think. Nothing has ever shown in that artery. And the next day, the specialist reached out to me and they were like, I looked at it again very, very closely, and it is a true dissection, just very tiny.
Dang.
And so then I had to reprocess having a dissection.
Jesus Lord.
So, like, it's just crazy because even nothing is certain with healthcare, which is so scary. And the only way you'll find out some things is if you literally get cut open.
Mm-hmm.
Maybe I should have had an angiogram. Just tie it back.
And how are you, like, monitoring it?
I'm going to get another scan this month, actually, to check and see if it's grown. So basically, what we want to look for is if the artery itself has bulged out, meaning an aneurysm, because the dissection area can cause it to weaken and it can bulge out. Or we want to check if the tear itself has gotten longer. That would be something to keep an eye out. Or if maybe it's just stable.
Wow.
We also want to check to make sure it's not blocking any part of the artery. So those are like the 3 things that a scan is going to check for. I am on baby aspirin right now. I take that because dissections, the blood cell, the platelets are basically trying to be Band-Aids and patch up the dissection.
Right.
And then blood clots are forming because that's what they're patching it up, and it could break off and cause a stroke. So the aspirin is to prevent those blood clots from forming. Mm-hmm. So we'll see if, I don't know, if I need to reprocess some more things. But that goes on to like having a discussion with your doctor to say, hey, I'm still having this pain. This doesn't make sense. And then them taking a second look. Like that is how this shared decision-making patient-doctor relationship should go. And I think you have a story where you were pretty pleased with your doctor recently.
Yeah. So I went in because I had been having like a sharp pain in my knee. And it just happened like randomly one day too. So I was like, it'll go away, right? Like sometimes my knees just hurt, like old. But it hadn't gone away. What did I tell you? Like a month and a half? It had been a while, and then I finally went to the doctor. And I was already like, I don't want to listen.
Really quick, sorry. It was after you got the injection because of this pain.
Yes.
Okay.
Yeah, this is the same doctor. No, you're good.
Continue.
It's because I've been seen for this same knee so many times, and there's been so many different things that it gets confusing. So that's where I was at, and that's what I was going to say, too, is that, like, I've done therapy for it. I know how to do the exercises. I was just like, I feel like something else is going on because it's been too long. Like, usually I can just, like, nurse it for a week, and then it's fine. So I'm already, like, going into the office being like, okay, they're just going to give me the same runaround, right? But the doctor was somebody that I hadn't been to before, completely different office, or so I thought. But I'm waiting in the room, and he comes in. He's like, we've seen you before. I remember you. And I was like, oh, it's because I went during COVID.
Oh.
I feel like everybody, like, during COVID, like, it's just,
it wasn't real.
It wasn't real.
Alternate timeline.
Yeah. And then I was like, I don't think so. He's like, no, yeah, we saw you at the other side of town. I was like, oh, I didn't remember. He was like, is this the same knee you're having problems with? I was like, yeah, it is. So then he just told me, it was like, help me out here, Isabella. The tendon? Is a tendon and a ligament the same thing?
No.
Oh, well, I forgot which one it is. I think it's the tendon, though.
So tendon connects muscle to bone, and ligaments connect bone to bone, if that helps.
He said it's the one that goes all the way down from, like, your lower shin all the way up. So it's like,
I think that's a tendon.
Okay, I think it's, when I said tendon, it sounded right.
Yeah.
That I had probably just, like, I don't know, strained it a bit, which is usually what happens. Gave me an injection, but just, like, made me feel heard, and, like, especially that they remembered, you know?
That's so special.
Everyone and their mother has knee pain,
yeah.
Right? Like, I am just a rando, and, like, yeah, I know he looked at my chart, and he read my history and all that, but, like, it just felt, like, genuine.
Right.
And he took his time.
Yeah.
I cannot stand when I've been in a doctor's office for 2 freaking hours, and then they come in here, yeah, you just gotta lose weight, yeah, you just gotta do this and do exercises, and yeah, have you tried swimming? Yeah, I've tried swimming.
Right.
I love swimming. What's wrong? What can I do now? So he gave me a solution right then and there, and it was just a nice experience.
That really is like, I don't want to say customer service, but it really
No,
makes
it
a
is.
difference when they pay attention to little details. It's just like in any relationship or friendship.
Mm-hmm.
If somebody remembers such a like little special detail about you,
Yes.
it's so heartwarming. It makes you feel good. And then you're more willing to like be engaged
Right.
with the care, with the doctor. And that actually reminds me of so the year before my colon most recently perforated, in 2023, I ended up, no, 2020, was it 20? Yeah, the beginning of 2023, in like January, I actually ended up in the hospital with some intestine inflammation. And the rotating doctor there, he didn't make a big deal on me. I'm just like, just another guy taking care of my intestines. And 11 months later, in November, when my colon perforated, it was the same doctor on call, and he remembered me. He was like, I remember you. Like, you were here for the inflammation and took care of you, and, like, you looked pretty good then, and you don't look good now. And so the fact,
I
like...
love a king that remembers.
Yeah, it was so... I was like, you're going to take such good care of me. And he did. It was amazing. But who would have thought out of all the patients he's seen, especially not even doing treatment for me because I was just being observed and you're just giving me antibiotics, like, how do you remember me?
No, I feel like those words mean so much, especially like for you and I, because we love like the little details, like, oh, I remember you.
Yeah.
That's how my foot doctor is too. He's like, again, why are you in my office?
I love those doctors too. Like my PCP/orthopedist, when I have an appointment, he walks in the door, he's already shaking his head at me.
Yep. What do we do this time, girls? Which foot? Which calf?
Yes.
Both?
Same with the knees. Like, they just already know that our lower extremities are up to no good.
They're no good, ever. Jeez. Well, I like when doctors remember. It makes me feel special.
So, to the medical professionals, listen, remember, peace.
Peace, love.
Or we could even do like listen, remember, heart, love.
Oh. Hold on.
There we go.
Fearless.
You have to be fearless to talk to your doctors.
You do.
You have a little bit of fear.
Well, we want to thank you guys for listening to us. I feel like that was one of our yappiest ones, and I love it.
I agree. We actually had energies.
Yeah, we did. Everybody woke up at 8. Bella had her coffee. And we were ready.
I combed my hair.
Oh, I didn't.
Wow.
Look at us. But thank you for listening. If you want to send in your stories, you can always click the link in our investigator Instagram and you can submit it, or you can just DM us and we always will keep it anonymous. Remember, you can listen to us wherever you get your podcasts, and then be sure to like and subscribe on YouTube and follow Investigator. I'm always plugging Bella's Instagram.
Thank you. We'll see y'all next episode. Thanks for listening.
Bye.